My name is Tammy Melton. I'm an MSN student at Eastern Kentucky University. Today I will be presenting the information that is included in my poster presentation on the effectiveness of CBT for the treatment of anxiety in adults. Anxiety is a mental health problem that greatly impairs the lives of many individuals at the national, state, and local level. It is a significant problem faced by psychiatric mental health nurse practitioners in all treatment settings. According to the National Institute of Mental Health, there is a rate of 18.1% of adults who suffer from some form of anxiety and 22.8% who suffer from a severe form. The purpose of the proposed project is to explore the effectiveness of CBT with adults who are age 18 years of age and older and are diagnosed with an anxiety disorder. The target audience for the project is adult patients diagnosed with anxiety disorder and receiving services at an outpatient psychiatric program at Mary Breckinridge ARH Hospital in Hyden, Kentucky. 5 randomized control trials were selected for review and found support for cognitive behavioral therapy. The findings of each study found support for the efficacy of CBT in decreasing symptoms of anxiety. The studies found support for CBT in reducing anxiety symptoms of worrying, physical symptoms of anxiety, panic, fear, avoidance behaviors, and social anxiety symptoms. The proposed study will assess the effectiveness of cognitive behavioral therapy on the reduction of symptoms associated with anxiety symptoms over a 6-month period. The target population will include adult patients who are 18 years of age and older who suffer from anxiety and receive services at the outpatient program. All patients enrolled will be given the opportunity to volunteer to participate in the project. Recruitment will begin by verbally educating all patients who receive services at the psychiatric program about the project opportunity. This recruitment will take place in the form of verbal and written information on the project. Following completion of patient education of the project, verbalization of clear understanding of the process and purpose, and written consent to participate, patients will be scheduled to complete anxiety inventories. Patients will attend the program 2 days a week and will receive 45-minute to 1-hour individual CBT sessions. The process will begin with the administration of the inventories to establish a baseline for symptom measurement. The CBT will begin the next day that the patient attends the program. After 3 and 6-month periods of treatment, patients will be given the inventories again to assess for changes in symptoms. The Beck Anxiety Inventory, also known as the BAI, will measure specific anxiety symptoms, and the Worry and Anxiety Questionnaire, also known as the WAQ, will assess symptom severity. The data to be analyzed will come from the pre and post BAI and WAQ questionnaire results. Data collected will consist of scores on the pre and post-test questionnaires. The data assessed will include symptoms and severity of symptoms. Intention to treat analysis consisting of mixed models with random effects will be used to examine change on outcome variables over time and to compare changes from baseline to follow-up at 3 and 6 months. Cohen's D will also be utilized for data analysis.